Good morning and welcome to the Turing School Interviews, a series of online meetings with experts on the regulation of market and services to understand what is happening and which have been the reaction to this pandemic, COVID-19, and to better understand which has been the transformation in the way public services have been organized and which have been the reaction. And today we are happy to have to discuss with us Marco Caniato, who works for UN OCHA, and he's an expert in the waste sector. Welcome, Marco.
Thank you. Good morning.
Good morning. So, first of all, I would like to ask you which, if you can describe us which has been the impact of COVID-19 in the waste sector in general, and then if you have some example or case which are particularly interesting.
Thank you. And yeah, I mean, as several sectors, also solid waste management was particularly affected by the COVID crisis at the global level, with different countries that reacted in different ways. In general, of course, we can see that the sector was impacted in two ways. One was in the management of municipal solid waste, and the other one in the management of special waste, especially the healthcare waste, so waste generated by healthcare. In general, we can see that a lot of people were very afraid of the situation. So first of all, a lot of communication was addressed to contain the situation and give proper information to the people, but also to the waste workers. And in some cases, a lot of attention was dedicated to make them feel more comfortable in handling the waste. And that was very important. If we see about the impact in quantitative terms, in general, we saw a shift in the waste generation towards the households. What means that with people that due to the lockdown, so restrictive measures, social distancing, people spend much more time at home. So they generated more waste at home. While having shops, facilities closed, we have a serious drop of the quantity of waste generated in commercial malls, so the so-called commercial waste. But also factories were affected. So at least in some countries where really the restrictive measures were particularly severe. So that waste generation dropped as well. In general, it was decided to give priority to collect the waste in the most densely populated areas. And then, of course, the most critical waste streams, so the medical waste, the residual waste, and the bio-waste. Then we saw a large increase of medical waste, especially the infectious waste, and all the waste related to the containment and treatment of COVID. So, for example, the personal protective equipment. And we still see a large increase of this quantity. Unfortunately, due to the continuation of the lockdown measures and so on, also some parts of the waste supply chain was disrupted. So we saw problems in the transport of waste and the trade of recyclable waste. And also we saw countries that decided also to stop the separate collection of waste, the recycling of waste, and so on. So those were honestly quite impactful reasons, and we still see quite severe impacts. Just to give an example, on the 15th of May, the Plastic Recyclers Europe announced that the European plastic recycling industry is closing production due to the current market developments, and in particular due to the lack of demand, due to the closure of some plants, but also due to the record low prices of virgin plastic. So now virgin plastics is so cheap that I mean, recyclable plastic is not interesting anymore. And of course, it's a heavy hit for the recycling sector. And then this is in general, let's say, for the high income level countries. If we look at the low income countries and transitional countries, situation is even more critical because, let's say, the standards of waste management is not always as good as in high income countries. People usually are not so protected. The hygiene practice is not so good, and you have several vulnerable groups lacking completely PPE, so personal protective equipment. And a lot of people really rely on informal waste management activities, collection, recycling, and so on, for their livelihoods. So they were either heavily impacted because, they were at high risk, or they were preventing of doing their work in order to avoid to become a vector of the infection. And if some of them were already exposed to some stigma, the situation worsened. So yeah, was particularly impactful for those countries. We can speak about Brazil, for example, where that was heavily affected by the virus. In some countries, then we saw the tendency to try to burn the waste as much as possible and to allow, let's say, to move towards that direction, even if there were no evidence that a thermal treatment was required. So yeah, these are some of the most clear impacts.
Okay, thank you for this overview of what happened. And I would like also to ask you what happened from a regulatory perspective. So if the traditional instrument have been used, what happened if there was the need to create a new organization and system? So if you can tell us a bit about this aspect.
Thank you. It's a very good question, and honestly not so easy to reply because, COVID surprised everyone. And even if we had some indication about its approach, no one was truly ready. Not at the healthcare system, and especially in other sectors like solid waste management. So what we saw is that associations, groups, and so on started issuing statements, guidelines note, try to keep the market running and avoid any, let's say, hysteria from the regulators. We saw, for example, that in some cases, some municipalities started spraying and disinfecting the public areas as much as possible. And honestly, there was no evidence at all about the use of this, but it was done to keep the public opinion, let's say, control and avoid panic, most of all. And it was sort of admitted recently by some authorities. In terms of regulation, we saw some countries that issued indication, recommendations, and only at a certain stage directives, so to force the public utilities to change their way of working. In particular, it was done in terms of operations, but also in terms of occupational health and safety. So how to ensure the safety of the workers, but also to organize the shift on a rotatory base, so with different teams. So in case that some of them were tested positive, not all the workforce would have been affected by the infection. So these are some of the indications. In general, we can see that the EU, for example, tried to understand how different member states want to operate, and then push to keep, let's say, the business as usual. Because you know very well that the European Commission took the decision to go green and take a leading position in this sense. So of course cannot, let's say, stop recycling, cannot stop having a green approach. And honestly, once finally some studies were published and it was possible to have some good, say, evidence-based evidence about the situation, so they issued, for example, in April, some guidance note. This guidance note was issued by DG Environment, clearly mentioning that there was no evidence to infer that standard waste management procedures are unsafe or insufficient, or that household waste plays a role in the transmission of COVID. But of course, had also to say that people confirmed positive or suspected to be positive in home quarantine should properly handle the waste. So practically speaking, put them in one extra bag or two, keep it for a while. In some countries, it's up to 72 hours before being collected as residual waste. So, and then going to landfilling or incineration instead of recycling. While other countries, honestly, consider that pretty impossible. If you think about Italy and other countries where really people in home quarantine were so many, of course you cannot dedicate, organize a dedicated system. You can in case ask the people to deal with the waste in a different way. But I mean, and then there were also some practical problems, like countries that wanted to close the borders. So the system in Europe is very interlinked. So you really need to ship the waste from one country to another one to ensure the proper overall management. So they, at the European Commission level, they issue some documents to allow this to go on, even if countries close the borders, at least close the borders for people movement. And also they had to allow, for example, that movement document and green listed waste to be shown electronically. So less paper and more electronic documentation. Something quite obvious, but of course there was the need to put it in a directive to make it happen.
And in your opinion, when the situation will go back to the normality or to a different kind of normality? Like, in other words, how do you imagine the future, the near future, and let's see what will happen also next year. But in so far, can you tell us something about the next months?
So, good question. Honestly speaking, with the, I mean, now in Europe, countries are lifting all the restrictive measures. Yeah, there is still social distancing, but of course we are going back to a certain normality to a certain extent, of course. And so that means that also the waste, the quantity of waste will be quite similar to the situation prior COVID. And so we expect that, yeah, also in terms of waste management situation will be quite similar, with some slight differences, maybe more attention to enforce occupational health and safety measures, to wear PPEs and so on. And the quantity of PPE generated due to the infection prevention control measures, of course, will be higher than before. So probably that quantity will still be high. But what we expect is sort of going back to the previous situation. It will not be immediate because, of course, all the issue of the price of the virgin plastic will take a while to recover. So that price is still low, and it will take a while to be high enough to, let's say, push the demand of recyclable plastic. But from the other, let's say, from the other perspective, the European Commission is pushing to go in that direction. So, and they are also trying to activate some measures, also in terms of funds and state aid. So we expect that the market should go back in a quite acceptable time. So of course, I don't see the sector to be disrupted for so long. What could be considered quite alarming is those businesses, those companies that were heavily affected by this period. So of course, who went bankrupt will not be on the market anymore. But yeah, unfortunately, quite obvious.
Yes, probably. Yeah, the market will change from this perspective. So thank you very much for this overview on the waste sector, and probably we will call you back in a few months to know what happened to see what will happen, how we will finish this year, this 2020. And but insofar, thank you very much for being with us.
Thank you for this opportunity.